Well, we've heard some rare good news in the last few weeks when it comes to the coronavirus pandemic, as two vaccine trials seem to be very successful.
At the same time, as we said at the top of the show, the nation has hit another milestone. More than 250,000 people across the country have died of COVID-19. That is about the population of the city of Madison. Joining us today to talk about all of that and a newly released at-home test kit is our Dr. Zorba Paster.
Hi, Zorba.
Hi, good to see you guys.
Later on, we'll take your calls at 270-9933. We'll let you know when to call in. First, let's talk about these two vaccines. It's pretty encouraging news.
Very encouraging. I mean, science, the technology is really amazing. These are messenger RNA vaccines. The important thing about this is, first of all, within 1 year, we have not one but two vaccines, and we may have more vaccines. It uses a different technology. It's different from the way we did the polio virus vaccine, all the other vaccines that we have, and the technology may actually bode well for the future. Both vaccines, the real protection comes from how many people were actually kept out of the hospital and kept out of getting serious disease. And the answer was many, many, many people. In other words, it was 95%. So in other words, some people may literally get a little cold, but people, 95% of them did not end up with anything serious. I think this is dynamite. Both vaccines will have some issues with transportation. The Pfizer one has to be kept super low in transport, but once it's actually diluted, it actually keeps for a week in normal storage, normal refrigerator. So we've got some challenges out there, but the fact is, folks, we have new vaccines. Next year at this time, when we're talking, we're going to have Thanksgiving.
That is great news.
Oh, Zorba, that is such great news. Let's talk a little bit about the news about this at-home test kit. How would that work, and could that possibly be reliable?
A very interesting test kit. I haven't looked at the data. They didn't do it on a ton of people, but they did it on enough so the FDA said this looks very good. It would be like a pregnancy test kit. I mean, what you would do is you would basically put a swab into your nose, put it into a container. 15 minutes later, you see whether or not it's positive or it's negative. And it's not as if it's going to come on the market right away, but the FDA said this data looks good. It looks like it really has very significant in terms of its sensitivity and its specificity, but it remains to be seen. Just like the other tests, we're rushing to market, even though we don't have 100% of the data. But the idea that you could do it at home is good. You won't be able to do it without a doctor's prescription because it goes to a doctor's office. That is not unusual when something first comes out. Often we want to keep it under medical care because if it's positive, you want to know what to do, and that's why you'll have to be connected to a healthcare provider.
But we're not sure how accurate it is at this time.
I don't think we know what the accuracy. The accuracy is reasonable. What is reasonable? Well, I think the FDA looks at reasonable, and I can't get the exact number, but it's got to be at least in the 60-70% I'm picking it up. And to give an idea, the influenza test picks up 60 to 65% of all the influenza. In other words, the false negative rate on a typical influenza testing site from swab to the test is about 30 or 35%. So the influenza test is far from perfect. If this fits at least within that range, I think it's good news because the more we test, the more we'll treat. And until that time, it's mask up, wash your hands, social distance, get society moving by doing that, and believe in science. Don't believe in myth.
All right, 270-9933 is the number to call. We'll get to your calls right after this. Stay with us.